as well. So his VHS, here's the long axis measurement, carina to apex. We count number of vertebral bodies, and we get 6. And then we'll take the width measurement here across the widest part of the base, right below the cava, and we'll come back up to the 4th vertebral body and count number of vertebral bodies and get a second number, which is going to be a little bit more than 5, so it's 5.2, and add those together and get 11.2. And that number is more than 10.7, and so we know that his heart is big. When you take these two measurements together, remember you're always starting at the beginning of the 4th vertebral body and counting both measurements down here, and you get these two and combine them to get a total number. Now for this dog, what's really important for Chip is that this number is bigger than normal, but also I knew his heart was big for a couple of things that we looked at before, which is that he has left atrial enlargement and he has dorsal deviation of his trachea. So you just put it all together to get an assessment of heart size. Now we're going to look at lung patterns. So lung patterns in heart failure, we're looking for pulmonary edema, which looks like an interstitial pattern, or sometimes an alveolar pattern. This is an example of an interstitial pattern in a dog with left-sided heart disease. So what we notice is that if you follow the caudal border of the heart here, it comes up this direction, kind of gives you the idea that there's left atrial enlargement, but the left atrium is really fuzzy. It's not nicely delineated. And this fuzziness here is the interstitial pattern that we see with pulmonary edema. In this dog, it has a pretty diffuse orientation. You can see it here caudodorsal, but also cranial. And I just lose the ability to really distinguish the cardiac silhouette and also the vasculature. If you look over here on the dorsoventral view, it's very diffuse as well, equally as much on the right side and the left side, very fuzzy in the lung fields. This is an interstitial pattern. What's important to remember is that we typically see an interstitial pattern with left-sided heart failure. So you have left-sided heart disease, you get pulmonary edema, and this interstitial pattern. Sometimes an interstitial pattern will become more dense, and then we develop an alveolar pattern. This dog had a diffuse interstitial pattern that was becoming alveolar here. It's becoming so dense that I can actually make out the airways, and here you can make out airway structures very nicely because of this alveolar pattern that's developing here. Now, how do I assess risk of congestive heart failure? What I'm looking for is a couple of things. Left atrial enlargement, which this dog has. So follow the caudal border of the heart here. I can see it bow out this direction. When the left atrium is big, then there's increased risk of them developing congestive heart failure. So that's one of my things that I look for assessing risk. And we also look for pulmonary venous congestion. Do the veins look big? And we'll go into that a little bit further in a moment. And then I look, is there an interstitial pattern that would suggest there is pulmonary edema? So the things that I'm looking for risk, left atrial enlargement. So when the left atrium is big, there's increased risk of having congestive heart failure. If the pulmonary veins are enlarged, and then also if there's that interstitial pattern that proves to us that there is pulmonary edema. So in this image here, here's the left atrium. If you had a dog with mitral regurgitation that's filling up the left atrium, making the pressure increase, the veins increase as well, and then fluid leaks out into the lungs. So the part to remember is when you have left atrial enlargement and you have an interstitial pattern, one of the things that I'm trying to look for is the connection. Do you have pulmonary venous enlargement? So how do you assess that on radiographs? So here's an example of being able to look at pulmonary veins on two different views, and I'm looking for pulmonary venous enlargement. On this lateral view, remember you can look at the vessels in the cranial aspect here, and what I look for is a dark airway with an artery above it and a vein below it. In this case, the vein is bigger than the artery. And then there's two other places that you can look for veins. Over here in the dorsoventral view, you can look for a set of paired vessels in both caudal aspects. So you look here and you say, okay, well, what I look for is a dark airway, and then you'll have a vein that sits on the inside of that. That's the pulmonary vein. And then over here, again, find the dark airway, and there should be a vein sitting on the inside of that. The veins sit on the inside aspect of both of these airways. It's not uncommon to not be able to see them in all three places, but that's the nice thing about having two views is you can look in three places to find the best area where you can make out the veins so that you can assess them adequately. So here's a zoomed in image of the same lateral radiograph, and here's the vein.